Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, an update to a previous story. A plastic surgeon is now suing a surgery center over the death of one of his patients. It's pretty wild stuff. And then rib remodeling. Is this really trending? Is it risky? Is it painful? We're going to tell you all about it. And then Kaitlyn Bristowe, fame of Dancing with the Stars and The Bachelorette, posted some absolutely unbelievable photos about her breast aug, but it may not be what you think, and I'm going to tell you what that is. I'm your host, plastic surgeon, Dr. Bruce Hermann. With me is Kalee Dion-Payer. How are you?
I'm good. How are you?
Doing good. Just running crazy today. We've got Brenna in the box. How are you?
Doing good. How are y'all?
Yeah, everybody's good.
Very good.
Yes.
All right, you guys ready to dive into some interesting topics?
I'm ready.
I am.
Okay, all right, let's do it. All right. Let's see. It was a few weeks ago we did a really sad story about Rachel Tussey. I don't know if you guys remember her. She was the influencer who was basically documenting her journey on TikTok about having plastic surgery. And I mean, it was really sad. Like, she documented the whole thing, and she made a video right before she went into surgery, and then it was like radio silence for, I don't know, a week or 10 days. And then her husband came and posted on her TikTok saying that she'd had a bunch of complications, and they thought they'd given her too much pain medication, and that she actually was brain dead. And then later that day, they took her off life support, and she passed away.
Sad.
And it was really sad because we were trying to figure out what happened, and at the time, you got limited information, and one of the things that was mentioned was, she got some pain medication after her surgery. And I had made the point that the amount of pain medication she got really was not that much. In fact, I looked at it, I was like, I don't think that's that much. And then I called all my anesthesia friends, and I was like, is this a lot? And they were like, no, that's very normal. And so, because a lot of people were saying that she'd gotten overdose on narcotics, right? Because that can basically make you pass out, and then you can't breathe, and then you can, have brain death like she did. And so we kind of didn't know what was going on, but we just wanted to talk about it. I was like, I bet there'll be more information coming out. I had no idea that what went down actually went down. So this is the crazy part. So an article came out yesterday about the plastic surgeon, and he hadn't said anything, but the plastic surgeon filed a lawsuit against the surgery center and the anesthesia group over her death. And that's kind of weird. I mean, I'm actually in the legal world for medicine, because I know I've told you guys a million times that I do legal consulting, and I hadn't heard of a doctor or surgeon suing a facility because his patients died. It's usually the family is suing, the facility. So it was like, that's really odd. And actually, the local news station posted his lawsuit, and I read the whole thing. I almost got left with more questions than answers after reading 32 pages. But he basically went full attack on a lot of people and said that she received a massive overdose of narcotics. So he's going full on that he got a massive dose of narcotics, which caused her to basically lose consciousness and then go into brain death. He is blaming the anesthesiologist for leaving too soon, which is, it's one of those gray things, because it does depend a little bit on facility and by state about how long the physicians have to stay around. But typically, at least for my patients, when they get to the recovery room, they're awake.
Yeah.
And at that point, it's just you're handing off to the nurses, and we all leave. I mean, we're available, but we don't just hang out for hours after the surgery. He blamed the PACU nurses for mismanaging everything, saying that they were the ones that gave her too much medication, and when she started having problems, they didn't call 911. And then he went on to claim, this is all alleged in his lawsuit, he's claiming that the surgery center tried to cover it up, that they destroyed medical records, and that when he came back the next day, that the medical records were different than when he was there the day before, meaning that he's claiming that basically they altered the records to make it look like, it wasn't as bad as it was. And there was some things in there. Yeah, it's just crazy. And so the surgery center, which is Journey Light, came back immediately, their lawyers, denying those allegations and saying that this plastic surgeon, his name's Dr. Torque, and we talked about him. He's a legit plastic surgeon. I looked him up. just to make sure, okay, is this guy really legit? And he is. I mean, he's a board certified plastic surgeon. Seems like he's totally on level. They basically say that he's doing this to try to get any blame off himself for what happened.
I was going to ask after this.
Yeah.
Like,
No,
your thoughts, like if you were ever in a situation, obviously you can't put yourself in that situation because you just can't. But like, is that something that you can really do as a surgeon to be like, hey, the packing nurses, like the anesthesiologist, this facility, they all were wrong? Like, wouldn't you know that while you're in there? Couldn't you have said something while you were in surgery?
Yeah, and that's where this whole story gets kind of wild because, the surgery center had some minor issues in the past. Like, there was an anesthesiologist that got upset because he said some protocols were not right. But I mean, realistically, that kind of stuff happens all the time. I mean, when you get like 50 doctors working somewhere, someone's always saying something is wrong. But so this plastic surgeon brought up, oh, well, you had an anesthesiologist 5 years ago that said that things were unsafe. I mean, people say that all the time about every facility that exists. So it's like you just don't know what to believe. And like, I probably as much as anyone can like weigh in on this because I'm a plastic surgeon. I also know like the legalities of stuff. I'm on the medical executive committee for a surgery center. And like, I'm looking at this and I just don't really know what to think because it's just weird that he did this, because what would more realistically happen is the family would sue the surgery center and then the plastic surgeon would maybe be a witness for them and say, yeah, it was unsafe and so on and so forth. But for him to sue the facility is just odd. Like it almost seems like optics. I don't know. And one of the crazier things, I read this whole report. It's 32 pages. The surgery was 9 hours long, which is an insane amount of time.
That's a long time.
Yeah, that's really, really long. And the only thing that the lawsuit says that she had done was a tummy tuck. Now, something we read said that she had tummy tuck plus liposuction. Something else,
we were reading that.
Yeah, something else said that she had a mommy makeover. But
like a lift.
The bottom line is like, I think it's really weird that he didn't mention what she had done and that the surgery went 9 hours. Because I do mommy makeovers all the time. And like, if they last 7 hours, that's a long time. Now, maybe he's just not fast or I don't know, but I just...
That's a red flag.
It's just like something that's unanswered is how I would say. It's like the first thing I want to know when someone dies after surgery is what surgery did they have? Because if she had a Brazilian butt lift, then there's a high risk of like fat embolism,
more.
And you can say, okay, well, maybe the surgery had something to do with it, but it's almost like it's being hidden what surgery she had.
Yeah.
And so, anyway, so the surgery center also had basically the records reviewed by independent physicians, an anesthesiologist, a pathologist, as well as the Ohio Pharmacy Board, and they all said that the drugs that were given were fine.
But if they change the medical records after that night, like
That's
that
true.
surgeon says,
I mean,
then,
you're right. It's like I don't know what to think about this case.
Because in my head, like, I would think as a surgeon, yes, okay, this sheep died and like there's gonna be repercussions, but like I'm gonna add more like attention to myself by having my own lawsuit. So there's gotta be some merit, I feel like, right?
I just don't know. I can't say either way. And you know what? And here's the worst part of all this because I remember saying last segment that we did about this, I was like, once they do the autopsy, everything will be answered. The family refused the autopsy.
Why?
I don't know. Like,
Well, okay, let me say something really quick. So they might not have refused the autopsy. Okay,
no, they refused.
Okay.
Well, it said that they refused.
Were they asked?
Yeah, multiple times.
Okay, because my mom passed away on a cruise ship. We won't need to get into the details, but when we were at the hospital, I didn't know you had to ask for one. They said that we denied an autopsy. We never even knew that we had to ask for that. So I do think that there's some verbiage there that they may not have even known they had to be the ones to ask for it.
Here's why I think that actually happened, because the surgery center asked multiple times for an autopsy. Why? Because they want to know what happened, because they probably think that what they did was not unreasonable and that she died of something else, which I wonder that myself. I don't know.
It doesn't make sense that a family would deny an autopsy.
It doesn't make
sense. Because they can't have a lawsuit without it. So
no, they can. You absolutely can. It just makes it more muddy, This won't even go to a trial.
Yeah.
Like it's gonna come out and I just don't know if there's more to it than.
Because when we went, I was looking into legal with what happened with my mom, and I was told it won't go any farther without an autopsy.
Well, that may have been something different. I mean, you can sue without an autopsy because sometimes it's not necessarily needed. But this is in this instant, it's like I don't know what happened to her. Like no one knows for sure what happened to her. I don't necessarily believe the opioid thing or the narcotics because she didn't get very much narcotics in surgery. That was my thing is, well, maybe they bombed her with narcotics right before she came out of surgery. And then she got.
Who tracks that?
The anesthesia, it's on the anesthesia record. Yeah.
Okay.
Anesthesia record and then the PACU record. So it's all there and it's just like, I don't know, man. It's just, there's so much to this story that doesn't make sense to me.
There is.
And then the plastic surgeon sues the surgery center and it's just like, what? I've never even heard of anything like that.
Yeah, it's pretty crazy.
I mean, it's just crazy. And it's sad. I mean, this lady lost her life. Like, it's really tragic, but I've almost got caught up in the mystery of it. Like, I want to know what happened to her.
Yeah.
So pretty wild. Okay, all right. I don't know if you saw a couple weeks ago, we talked about the very sad story of Rachel Tussey, who is an influencer who journeyed her entire plastic surgery experience up to the point that she went right into surgery. And then unfortunately, she died after her surgery. It was all in the news. It happened in Cincinnati. We talked about it a couple weeks ago, and we had no idea what really happened to her. Some people said she got an overdose of narcotics. And I was like, well, there's going to be an update. Well, an update happened, and it's absolutely unbelievable. The plastic surgeon is now suing the surgery center and an anesthesiologist saying they were at fault for her death, which is kind of odd. You don't often see a doctor sue someone else for the death of one of his patients. I mean, I guess it can happen. He released this big lawsuit with all this information. I read it, and I still don't really know what happened in this case. We're not sure if she got too much narcotics. It's definitely up for debate. We don't even really know what surgery she had. All I know is this is a really, really sad story that's just kind of spiraled into this unbelievable saga, and I don't think this will be the last time we'll talk about it. If we hear anything else, we'll keep you updated. So, all right. This is almost kind of this next segment's almost an update as well. You were here when we talked about the girl that removed her ribs, right?
Yes, I was.
Okay, so
yes, that was different.
This is basically a segment on rib remodeling, not rib removal. Rib remodeling, is this trending? Is it painful? Is it risky? And the reason that I brought up this segment is because USA Today actually did a big article about this, which is weird because this is not really a popular surgery whatsoever.
What is rib remodeling compared to like rib removal?
Yeah, excellent. Let's tell you. So rib remodeling is basically where when you make your little incisions on the back where you would cut the ribs to remove them, instead of cutting them to remove them, you basically either cut them or drill holes, and then here, let me do my hands. All right, these are your ribs. So you fracture them so that they bend inwards. Which is.
But what about your organs right there?
Yeah, that's a great question because
the first thing I think of is, do we puncture any organ?
They're definitely at risk. So yeah, I mean that is one of the things that can happen with this. And so, I'd heard of rib removal as kind of like an archaic thing, sort of back like when they used to drill holes in people's heads for headaches and stuff. Which I mean, that doesn't really happen. But I'm like talking like the caveman.
Sometimes I do feel like my head would feel better if I just drilled a hole.
Drill a hole, let out the evil spirits.
Yes, yeah.
But I mean, rib removal was kind of an archaic surgery that was never really done, and then this girl did it, and I was convinced she went out of the country. But I did mention that there is a newer procedure that is out there. And then, what is it? 4 months later, USA Today is talking about it. Like, this is not something a lot of people are doing. I did clip a little video, run that video of USA Today, because I clipped it because it was just interesting that they would be talking about this.
People are paying thousands of dollars to surgically reshape their ribs, and it's called rib remodeling. Rib remodeling involves surgically altering the ribs in order to create a more cinched waistline, and it's actually replacing a more dangerous procedure called rib removal, where the lower two ribs or more ribs were removed. Rib remodeling procedures can range in price from $10,000 to $15,000, and the recovery usually takes about 3 months and involves really strict protocol of wearing a very tight corset to make sure that the ribs heal correctly. I asked surgeons why they think that rib remodeling is starting to gain in popularity right now, and they said that there's a few different factors. One is sort of the rise of GLP-1s and more people losing more weight. Basically, as people lose more weight, they become eligible for more procedures, and there's more things that they want to fix.
I'm so confused.
What confused you? I'm here to answer
Well,
your questions.
I
why they would do an
wonder-
article about it?
I'm guessing they added the GLP-1 in there just for clicks, but I'm just wondering why that would make you want to remove a
Okay,
rib.
so that's a
or
great question, and I actually have an answer for that.
remodel your ribs.
And this is just speculation because no one can really answer this for sure. But with GLP-1s now, and like everyone can get skinny if they want, like this is like the next step. It's like, oh, everyone's skinny. I got to be skinnier, so I'm gonna remodel my ribs to like make my
I'm
waist.
feeling very bizarre right now.
It is bizarre. Like I agree with you, and we're gonna look at some pictures in a minute. But I don't know. Is it weird that USA Today is doing an article
Yes,
about
that is.
I mean, it's just strange,
Yeah.
right? It's almost like that the surgeons that they interviewed maybe like paid for it or something, because they interviewed 2 surgeons who do this, and one of them I think I snagged a photo off his webpage. I'm gonna show it in a minute. But all right, so I'm just gonna go out on the record right now and say I don't like this. I mean.
Yeah.
I would never do this surgery, never. And it's not that it's complicated. I mean, I do work with bones all the time. I mean, it's not a complicated surgery at all. There definitely is going to, be a learning curve. And I've never done one of these, although you could probably go somewhere and train. But I don't like it because, one, the recovery for something like this is brutal. I broke one of my ribs one time, like traumatically broke a rib. And it hurt for like months.
Yeah.
Like for months, like it hurt. And this is basically breaking 4 ribs, okay? I broke 1 rib and I was like, oh my God, it's the worst pain ever. 4 ribs broken. Everyone talks about how painful it is. I mean, that just to me, like that's right there a huge, huge red flag to this.
So can I ask a question?
Yeah, absolutely.
Are there any other procedures that you are breaking physical bones to make yourself aesthetically?
Sure. I mean, facial reconstruction.
I guess the nose.
Nasal bone, jaw, chin. I mean, they are out there. I mean, things have become more or less invasive. Like there used to be a surgery where if you wanted a better chin, they would cut the bone and slide it forward and then plate it. And now it's like, well, they just take like a silicone thing and put on your chin to get the same result with a lot less trauma.
Or you could just do a little
But I mean,
filler.
there are surgeries. What makes the rib surgery more painful is, your rib cage is constantly moving because you're breathing.
Yeah.
And like when you have a broken bone and it's constantly moving, it hurts. It's why we stabilize bones when you fracture. And we stabilize them so they'll heal, but also so that they're not hurting. You're not using it, right? But you can't stop breathing for 3 months, obviously.
I think I'd just rather remove it altogether.
It still would be painful. I don't know. Between the two, this is the better option. The fracturing than removing. Yeah, the removing's even worse.
I just think like if you fracture it and then you get hit with like something and then it fractures and like punctures something because it's not where it needs to be already to start with.
I didn't see anything. So I went through the risk. Let me tell you the risk because my first issue is the pain. I think the pain is pretty severe. I wouldn't want to put a patient through that. You do have to wear there's a very strict wearing a corset to basically remodel it and keep it from moving. So you have to wear a corset for weeks or even months. But the risks are, to me, too high. So 2 to 3% risk of a collapsed lung. So that's basically what you were talking about, puncturing, at least the lining around the lung so that it collapses. Up to 9% of patients report severe chronic pain after this procedure, meaning it's not like just you have pain, it goes away. And then there is the remote risk of like really puncturing an organ like your liver or your spleen, which can be potentially life-threatening. So, I mean, to me, like the recovery is too much, the risks are too much. But let's move on to do we even think that does it look good? So I got 2 sets of pictures. Throw the first one up there, Brenna. All right. I'm gonna get you guys' opinion. Girls, do you think the right picture looks better than the left?
No.
I don't think so.
I don't either. To me, it looks abnormal, like
It does.
like an alien type body. I mean,
Yeah.
I just don't like the look of it personally. Like personally,
Same.
I look at it and I'm like, it looks unnatural.
Yeah.
Yeah.
I don't like that.
It just looks like it's outlining her, like the bones.
Yeah, throw up the next one there, Brenda. The next one is a girl that's like an influencer.
Is that after?
Yeah, that's an
It
app. That's not
doesn't-
the same person.
Oh. But still, it doesn't. I don't.
Really doesn't.
I mean, I don't know what
much
she
different.
looked like before,
Yeah,
but
Yeah, I mean, I agree.
it doesn't
like,
look like the first one.
I don't think she looks bad. This girl looks bad in her clothes. I mean, if I look hard, I'm like, yeah, she does kind of have a small waist, but I don't look at it and be like, oh, that looks necessarily good or bad. It's just like, it just is what it is. But if it looks like the other picture out of clothes and you saw her in a bikini, I'd be like, whoa, what's wrong with her body structure?
Yeah,
You know?
definitely.
So yeah, I don't really know. Personally, to me, like all of that is not worth the look. And who am I to say what somebody wants, right?
Right. It's everybody's,
But I just look at it and like, man, I just don't see why people do this. Is this really trending? No, this is not trending. I mean, there are a few people doing this, surgeons, and there's probably a few people that are having the procedure done. This is not a trending thing. I'll look the next time, because we're about to get the 2025 plastic surgery report for what's been done, and I'll look for this, so remind me.
Okay.
What you mentioned about, we talked about that, because Ozempic is making people skinny, and then like this is the next step. Yeah.
But I'm like, why would you want to go the next step? Just enjoy what you got.
I agree with you. To me, this is going
But
too
again,
far.
no judgment.
Yeah,
Yeah,
I mean-
and it's not worth the risks of it.
Yeah, I mean, I'm not going to beat people up if they want to do this, but I would warn people not. If I knew somebody was going to do this, I'd be like, look, you need to think long and hard about this, because the recovery's brutal, there are risks, and I just don't know, like, is the juice worth the squeeze? You know what I mean?
Yeah.
So, all right. Rib-Remodeling, is this actually trending? Well, if you listen to USA Today, it is. They did a whole article about rib-remodeling, which I thought was really odd. We actually talked about this a few months ago when a girl was talking about her rib removal surgery, and we said, hey, there is something out there that's not quite as crazy. It's actually rib remodeling, where they just break the rib and move it in. And then suddenly I see a USA Today article about it. It's like your phone listening to you and you see things almost. I don't like this because the recovery is absolutely brutal. When you break a rib and then you breathe, which you can't hold your breath for 3 months, it's going to be painful. And people always talk about how painful these are. There are real risks with this. Things like collapsed lung, punctured organ, chronic pain, and it's expensive, $10,000 to $15,000. It's a hard pass for me. I mean, it's not insane to do this, but man, I would caution someone really, really hard to give it a second thought before you do this one. So, all right. Last one.
All right.
You ready?
My girl.
Now you know this girl.
Yeah.
Do you know her, or you just know her?
No.
Oh, okay.
I mean,
I never know who you know. I know
I'll be
you.
honest, I would listen to her podcast, and
Yeah.
I watched her from the moment she was on The Bachelor. So
Yeah.
like that's where she started.
Gotcha,
and then,
gotcha.
And she lives in Nashville, and
Okay. Brendan, do you know this girl, Kaitlyn Bristowe?
I do, but not too
Okay.
much of her. I've seen her.
I didn't watch The Bachelorette. I didn't watch The Bachelor. I didn't watch Dancing with the Stars. These are just not my wheelhouse. So when her name popped up, I was like, who's this?
She also like had a song and like did like a music video.
Did she really? Wow,
she's
she's
lived
kind
a
of
lot
like
of
a jack
lives.
of all trades.
Yeah.
All right. So this is about Kaitlyn Bristowe's unbelievable breast augmentation photos, and they're not unbelievable for the reason you might think. So she's 40-year-old Canadian reality star. She was on The Bachelorette. She was on The Bachelor. She was a winner of Dancing with the Stars, season 29, apparently. She's got the what's her name of her podcast?
Off the Vine.
Off the Vine podcast.
She likes wine like I do. I think she has actually wine.
I mean, it sounds like somebody
She has a
has-
wine line, I believe. I don't want to speak out of turn, but
She sounds like somebody would be awesome to hang out with. I mean, she sounds super cool.
I didn't know that, but I want to check it out now.
Yeah.
listen to the podcast. But it's a lot about like the Bachelor people for a long time. Like she has a lot of those guests on.
Does she?
Yeah.
So I can totally get how it's super popular. Well, she sounds awesome, and this is not in any way a segment that's dissing her at all. So if you're a Kaitlyn Bristowe fan, don't get alarmed. We're not going to say that she did anything bad. So this actually popped up in a news article, and my wife actually sent me to this because she sent me a picture. She's like, does this look right to you? And when I saw the picture, I was like, whoa, what's going on here? So that's what we're gonna like dig into. All right, so she made a 1-year anniversary of her breast augmentation. She posted a bunch of pics. And you know how people are. People were saying, yeah, this is great and this is bad. Anyway, it wasn't about that, but there was one thing that was really interesting. So first off, let's show the pic of her with her breast augmentation. It's like actually the title photo. Yeah, she looks good. It's a small
I think it looks great.
It's a small
She looks
augmentation. It's
hot.
not out of proportion to her body. I mean, I can look at that and be like, yeah, that's an implant. I can tell it's an implant, but I mean, it looks good. It's definitely acceptable work, at least for what you can see here.
Yeah.
But then there was the next picture which caught my eye.
Uh-oh.
Throw up the next one. All right, this is her after her surgery. So that is a drain tube. All right.
Oh no.
So that's a drain tube.
She
Now,
drinks too much wine.
No.
It was a joke.
It's just straight wine.
The appearance of that, so what that is that's a bulb connected to a tube. The tube's a little clear and blue thing coming off, and it goes into a wound after surgery. Now,
I had one of those.
For your...
Breast reduction.
Okay, that's...
Is that different?
Yes.
It was the weirdest feeling when they pulled them
now,
out.
I will
It was,
tell
like,
you
such a weird
that
feeling.
for breast reduction surgery, it's not unreasonable to put a drain in. I use drains for really large breast reductions. Some people use them all the time. But what's weird is someone using it for an augmentation. Like, that's not
Yeah,
really...
that is weird.
That's not really a thing. I've heard of like whispers of, someone doing that. Like, what? Someone used a drain for a breast augmentation? Like, why would they do that? And I say that because, one, there's no literature to support that. I mean, everything we do is based on literature. There's no literature whatsoever to support putting a drain tube in a standard breast augmentation, and there's actually a lot of research out there to suggest that it increases infection, it increases scarring, and overall is just a bad idea. And so it's like, oh, that's really weird that someone put a drain in that. And then immediately I'm like, who did this to her? But then the next picture is what really sent me over the edge. So throw up that next picture. And I have to explain what you're looking at. So you're looking at the incision, and the drain is coming out the incision. That is absolutely just unheard of. Like, when people, and lots of surgeons use drains, but you don't bring a drain out through the incision.
It's at like the top, right?
Like, you bring it out far away, because what that does when you have a drain going through your incision, it makes an open space for bacteria that's on your skin to go into your incision where things are trying to heal and then get into where your implant is. Like, that's just absolutely bonkers to see someone pull a drain. Like,
did she have any context for this photo? What was the...
She was just recapping her augmentation.
Did she say why?
Well, there was a lot of people in the comments, and I went and commented too, and I was like, who did this to her? Like, because I just like, one, drains and augmentations are not a thing, and two, who brings a drain out through an incision? Like, I tried to think of an analogy of to how crazy that is, like to bring a drain out through an incision, and I just couldn't think of anything that made sense. But like, it's just not something you do, because it's well documented that putting a drain through your incision increases infection, and also it makes it where you're more likely to have healing issues. Like,
Well,
that
yeah.
incision's trying to heal,
Yeah.
and there's something holding it open.
Yeah, that's
Like,
so crazy.
Where
Yeah, they come out on the side.
Yeah, so
Yeah.
like my
Yeah.
drains were here, and I have like kind of the scarring
Yeah, you got like a little dot.
dots.
Yeah.
Yeah, because of
Yeah.
that. But it was definitely nowhere. It was north of the scarring, I guess. Like the other.
Right, it's away. Like, it's
Yeah.
anybody who's a surgeon knows that you don't pull a drain out through incision. You pull it far away to keep it.
So did anybody respond to you? I'm sorry. I need to know who did this to her.
I did too, and so I am on this wild goose chase to try to figure out who did her surgery, and I was
Well,
like
she lives
using.
in Nashville. We could do this. We could make this work.
I mean, if you can find out, I
gonna do some
I would bet
investigative
any amount
reporting.
of money, and I shouldn't say that, because as soon as I say this, I'll be proven wrong. I feel very, very strongly there is no way a plastic surgeon did this to her.
But she has enough money.
It doesn't matter. Like, people, celebrities all the time go to like non-plastic surgeons because they don't know any better. Like, they don't know who's who. It's hard for anyone to tell.
Yeah, that's true.
We've talked about that. That like, anyone could put up a website and say
I
they're
feel
a
like she's a very
cosmetic.
smart woman, though. That surprises me.
I mean, and I'm not
I
blaming.
don't know her
I'm not
personally,
blaming
but-
her. Like,
Yeah.
I'm not like saying that she's a dummy because this happened to her. Like, I'm blaming whoever did this to her. And maybe it worked out fine. I mean, maybe because when you look at the external picture, it's like, yeah, it looks pretty good, but you never know if it like got scarred up or contracted. I mean, without seeing more photos, it's hard to tell. So you never know if like maybe she did have some complications from this. I mean, who knows? But all I can tell you is that it's really risky and it's a really bad idea to do it. And I was like, who did this to her?
I feel like she might have posted those pictures for a reason, but like because she's such in the public eye, she didn't like spell it out, but she kind of did that to be like, this went south. And
You think maybe so?
I mean, because that's what I would
don't
do.
know. No, because I think that like on the post she was saying she was happy. I don't know. I was like, I actually commented on her Instagram post. It was
I don't
that
know.
one. You should look at it. It was only 3 days ago.
I'm going to.
And
I'm about to do some investigative
I was like,
work.
what? Drains? Drains through the incisions? This is chaos. What's going on?
Yeah.
So I wish let's go on a hunt. We got to
Yeah,
figure out who did
I'll
this.
report back.
I
I've got work to
really
do.
feel strongly that a brethren plastic surgeon would not do that to her unless they're just 1,000 years old. Like, about to turn to dust old plastic surgeon that like is doing stuff that was done in like the 70s maybe.
I'm gonna find out.
I want to know. All right. Should you have a drain tube with your breast augmentation? I say no, as does 99.99% of plastic surgeons. And the reason we're bringing this up is Kaitlyn Bristowe, who is known for her podcast and being on Dancing with the Stars and being on The Bachelor and The Bachelorette, posted a picture of her breast aug journey from a year ago, which was fine, except she had a picture of a drain tube after an augmentation. But even crazier, whoever put the drain in pulled the drain out through her incision instead of an area away from the operative site, which is common. And I was like, oh my gosh, this is like so not how this should be. And so I just had to talk about it and say, look, if you have a surgeon that's doing a standard breast augmentation and they want to put a drain in, you may just have a little pause about did they really know what's going on? Because I promise you, the overwhelming majority, 99.9% of plastic surgeons aren't going to do that. And if someone's saying they're going to do it, there's a very high chance they're not actually a plastic surgeon. Unfortunately, we couldn't find out. I couldn't find out who her surgeon is. If you know who her surgeon is, let me know. I got to know who this is. I got to know who did this to her. All right. I think that's it. All right. We made it.
We did it.
Kalee, we're good?
I gotta bounce.
All right.
I gotta bounce, but I will find this out because you know what I'm gonna do is I'm gonna find out when it was and I'm gonna go listen to the podcast for like
Okay,
the
all right.
month leading up to it. And here
Okay, let me know. All right, thank you guys so much for tuning in. We really do appreciate it. Please hit that like, subscribe button, and leave us a comment. We will talk about the topic you want to hear on the next episode of Nip Talk. Bye.
Already.